President Trump's many executive actions of the previous week included decisions to withdraw from the World Health Organization, along with freezing research, including cancer research at the National Institutes of Health, and reversing some of the Biden administration's initiatives to reduce prescription drug costs. Joining us now is Will Humble. He's Executive Director of the Arizona Public Health Association. Will, good to have you here. Thanks for joining us.
Thanks, Ted. No problem.
We'll get to some of the other stuff first, but let's talk about the WHO. What is the World Health Organization?
Yeah, the World Health Organization, it's part of the United Nations network of activities, and it's really designed to be a place that helps, especially developing countries, to have healthcare and public health infrastructure, laboratory capacity. And so the donor nations, all the members of the World Health Organization contribute. The U.S. has been contributing about 18% of the budget. The new president objects to that amount of money. It's $400 million. But it goes for things like tuberculosis control. You remember the Ebola epidemic a few years ago? They really worked on that hard and then even developed the vaccine for that. Polio eradication, even working with clean wells and water, so to interventions for diarrhea. So it's a lot of work in the developing world to help them control infectious disease and other chronic diseases better.
And when the president signed the executive order, he commented, "Ooh, that's a big one." I mean, why is this in the crosshairs? What's going on here?
Well, if you read, basically he's mad about COVID. Part of it is he's mad about COVID. Now, remember, he thinks it was mismanaged by the WHO, et cetera. The U.S. tried to quit the World Health Organization at the end of the Trump administration, the first Trump administration. When you say you're going to quit, it's a club. When you say you're going to quit the club, the bylaws say you can't leave for a whole year. So President Trump formally quit a year before, and then President Biden came in and joined back up.
Yeah.
Also, the Biden administration already paid the 2025 dues.
Oh, interesting.
Yeah,
okay, so
we're prepaid the 20 because he was in the office for a few days.
So
yeah.
okay, it's about a year away. But I mean, the current president, called it a corrupt globalist scam, and that it's ripping off America, and it mismanaged, covered up COVID. He still seems to think that it came out of a lab, and the WHO just covered the whole doggone thing. Does he have a point on these things?
Well, so the WHO really did try hard to get into China to answer some of those key questions. The Chinese government did limit the access to the WHO researchers, and so there was some trouble actually doing that kind of work, but it was because a lack of access by the Chinese government, not mis or malfeasance by WHO.
What is the impact of the U.S. leaving the World Health Organization?
The most immediate impact will be a budget reduction. So U.S. pays 18% of the WHO budget. That's about $400 million. But like I said, we prepaid 2025.
Right.
So in 2026, they're going to have to look for additional revenue from other countries. My guess is China's going to jump into the leadership role. This gives China an opportunity to really drive the bus at WHO because we're quitting the club.
Yeah, and it is leadership. I mean, this is a leadership position.
Well, so yes. So there's a World Health Assembly. That's all of the nations that are part of WHO, which is basically it is every nation except for us now, or going to be. And then there's the executive board, which you can think about at the UN, that's like the Security Council.
Yeah.
So that's the piece that really drives the policy. We're not going to be there for that anymore. So my initial reaction to leaving WHO was, oh no, this is going to be bad. But the more I thought about it, the more I thought, okay, so they have a whole year to plan to fill that 18% gap in their budget. And they also don't have to deal with this administration and their decision making, and they're meddling for the next 3.5 years.
Unless in the next year this administration reconsiders.
I think they will.
You think they will?
I think they're going to see that China decides we're going to pay your dues, we're going to be the dominant force at the WHO, and then because they didn't think things through, they'll realize, and then they'll say the reason why we joined back that's not that reason, but that's what's going to happen, I think.
The National Institutes of Health here, freezing research at the National Institutes of Health, and we're talking cancer research, we're talking all medical research?
$47 billion of mostly medical research. It's the biggest portfolio of medical research in the world. And it is on hold right now.
Why target that?
You're asking the wrong guy, Ted.
But I mean, there's got to be.
Well, I think what they wanted, I'm going to guess.
Yes.
I'm going to guess and
Go
say
ahead.
they want to make sure that they're not funding things that have to do with some stem cells or something because they're against the embryo that it came from. I don't know. But the effect is, WHO, sorry.
Yeah, NIH. Yeah.
NIH doesn't just fund things willy-nilly. There's a whole process for how they decide we're going to fund this research project. And so there's review committees that meet periodically, and they're scheduled out like a whole year in advance. And there's a whole bunch of homework they have to do in advance of these meetings. Those are all suspended. The travel is stopped. And so eventually, I think this research is going to go on, but not until there's been enough of a delay that maybe suspends a lot of this research for at least a year. And my guess is they're going to decide to overrule some of these advisory committees and not fund some of it because they object to the kind of research that the review committees are considering.
All right. Before you go, the Biden administration had a lot of prescription drug actions going on,
Right.
capping for this and capping for that. What's going on? Because I've heard he kind of cut that as well or stopped that as well.
Yeah, but it was an executive order on that, but it's really not that consequential. I just want viewers to know, remember the Inflation Reduction Act that finally gave Medicare the opportunity to negotiate a handful of really expensive drugs? That authority is still intact. That executive order is not going to end that. I am a little concerned that they might not be as aggressive of negotiators as the previous administration was on some of these drugs and let the drug companies get off easier. Time will tell.
Yeah, Medicare and Medicaid affected?
Medicare mostly.
Medicare mostly.
But, well, on the executive order that the president just signed, really, it's negligible. Honestly.
Okay, so this was more of a headline than an actual effect.
Yes, that's the way to say it.
Okay,
Yeah.
all right. Will Hummel, a lot of things going on out there in the health field, huh?
Yep.
Brave new world.
All right.
Good to have you here.
My pleasure.